Hi, I'm Dr. Akmal, one of the consultant cardiologists here at Gleneagles Hospital, Kuala Lumpur. Some of you or your relatives may have to make that visit to the hospital if they develop symptoms such as chest pain, breathing difficulties, or palpitations. This can be quite a daunting experience, and we understand that. In this video, I will share with you the journey that you may have to go through while undergoing some tests and treatments here at Gleneagles. I hope that you will find this helpful. During the consultation, we will find out more about the symptoms that you have been experiencing. You can share with your doctor the onset of the symptoms, the duration, timing, the severity, the aggravating factors, and other associated symptoms that you may have. We will look into the risk factors that are usually associated with heart disease, such as your smoking habit, family history of heart attack, or your past medical illnesses. Some of you will benefit from an ultrasound scan of your heart. This test is known as echocardiogram. Here we have Ms. Atira, our very experienced echocardiographer. She will place a gel and the ultrasound probe on your chest to acquire the images of the heart. It is a non-invasive yet a useful test to look at the structure and the strength of the heart muscle, the valves, and the blood flow within the heart chambers. Some of you may need to undergo a stress test. Atira?
In this test, we will get your heart rate up by exercising on the treadmill. You will begin with walking, and the test will slowly progress until your target heart rate is achieved.
You will have your ECG and blood pressure recorded during the test. This allows us to detect changes in the ECG that may suggest narrowing of the blood vessels of the heart. Traditionally, cardiac CT and ultrasound have been the workhorse of imaging modalities. Cardiac MRI is an advanced and new imaging technique that allows detailed assessment of the heart. The main advantage is that there is no radiation exposure to patient. Here we have Mr. Yusri and Mr. Amshah, our experienced MRI technologists. Yusri?
On the day of the test, we will make you comfortable and brief you on the cardiac MRI procedure. You will get your images and reporting on the same day.
If your earlier investigation suggests that you have a narrowing of the heart vessels, the next step of the assessment and treatment will involve a procedure known as the coronary angiogram and angioplasty. You are likely to be admitted to the hospital. Here we have Farah, our very experienced scrub nurse. Farah?
The procedure is performed inside the dedicated unit known as the cath lab. There are various members of staff who are involved in the care while you are undergoing the procedure. There are scrub nurse, cardiovascular technician, radiographer, and your consultant cardiologist.
This procedure is done under local anesthesia. It involves insertion of small tube through the wrist. The tube is then advanced through the heart and guided by fluoroscopy. Contrast will be injected and the images of the blood vessel is well visualized on the screen. If we discover that you have significantly narrowed heart vessel, the treatment of ballooning and stent implantation will be done on the same sitting. After a successful procedure, patient will be observed in the recovery area for a few hours. Majority will be discharged on the following day. Patient will be advised to avoid strenuous activity involving the arm where the site of the angiogram was done. And after 2 weeks, they should be able to resume normal activities such as golfing and swimming. I hope this journey gives you a better understanding about heart diagnosis, treatment and care. If you have any queries, please feel free to contact us. Until next time, I'm Dr. Akmal, and together with Gleneagles Hospital, Kuala Lumpur, Remember to take care of your heart and stay safe.